Hi Max, good day. So hope you had a good day, and just wanna let you know that I don't have much videos or vlogs to upload this week. That's for the fact that me and my partner are tested COVID positive, and we are isolating right now. So as you can see, this is my bare face, always bare face. So inani cute pag magsakit, no? So kapoy kayo, kapoy lihok. But I'll try my best to give you some short clips of what happened during our first 3 days of isolation. And we just want to grab this opportunity to thank our friends for and our family for reaching out, asking how are we going, and those friends of ours that tried to message and call us asking if we need something or if there's something that they could help us. So we're just very thankful for all your help and support, guys.
Those who left food for us.
And kapatid Ivy for leaving food outside for us. So, it's very hard if you're in isolation. Then we, as much as possible, we have to stay at home. So there's something that you want to eat but you can't, because you cannot just go outside and walk around outside. So yeah, hopefully everyone is well, and I'll just pray that we'll get better soon so I can continue and start uploading new content that might inspire you guys. So guys, as we all know, there is mild symptoms for COVID and there is also severe symptoms for COVID. So it is very important that we know when symptoms become severe. So these are the things that you should seek urgent medical attention if develop severe symptoms, such as you got difficulty breathing, your oxygen level is less than 92%, when you got that blue lips or face, pain or pressure in the chest, so that chest pain, cold and clammy or pale, fainting or collapsing, being confused, becoming difficult to wake up, little or no urine output, and coughing up blood. So let's say for example you got COVID, then you've noticed any of those symptoms, severe symptoms, then for sure that's the best time that you have to call the ambulance or call 000, because that is no longer considered as a mild symptoms that could lead to a more severe or serious illness. So it is very essential that we know how to classify a mild to a severe symptoms. So if you got confusion, we got in WA, we got this Health Direct hotline. Feel free to give them a call, and you just need to answer some questions that they'll be needing from you, and by then they can assess via phone and they're gonna give you advice what you have to do or what are the things that you can do as well. Let's say same with PS last time. She got fever, so I was advised that as much as possible she shouldn't be wearing thick clothes, thick blanket. So as much as possible, just light clothing. Then do not put any patches, cold patches on her. So we can have those, what do you call that thing? Towel. Wet towel, but just on the forehead. Wet flannel just on the forehead. But do not put any like cold patches, because the nurse said that would trigger the fever. We'll be giving some tips that you can use in case you have to do isolation at home as well if you're COVID positive. So the first thing is make sure you drink a lot of water or fluids. So that is very, very important.
Electrolytes.
Second, Having hydrolyte or electrolyte ice block is very helpful as well to keep you hydrated. So make sure
Orange
you
powder.
got those as well. Then third is make sure you rest well. You need a lot of rest. Fourth is make sure you try to eat food, fruits, and vegetable. Because though we don't have that appetite, but let's try to eat food just to give us some energy, especially that we have to intake some medication as well. Then have some paracetamol and ibuprofen every 4 to 6 hours. That would help you, ease the pain, body pain, headache, fever, cold and flu. So regular medication. And sixth, make sure you do proper hand hygiene. So what we're doing right now is we got a box of tissue, then we got wet wipes. So every time you cough or sneeze, it is very advisable that you don't sneeze using your hand. So make use of those tissue and wet wipes. So when you sneeze out or cough, then you can just throw it away. So those things are very important, and it's essential as well that you got some sanitizer or alcohol just to disinfect your hand or disinfect some surfaces in the house that you keep touching. Hopefully we will recover soon, and yeah, uh just hoping for all your prayers that we'll get through this COVID journey. So the history of this COVID journey is we got it from our housemate. So he had it first. Then after knowing that he got COVID, we were identified as close contact, and straight by then we were asked to do isolation as a close contact, since we both work in the healthcare. So we are required to do at least 7 days isolation, though there's no symptoms yet. So after 4 to 8 hours, I'm the first one who got COVID, and my first symptom was sore throat around 6 a.m. So I feel so ill, like I got this very scratchy throat. So I get myself tested, but it's negative. Then around 11 a.m. that day, I had a very bad headache. Then later that afternoon, I had a very bad muscle and joint pain, and I feel like I'm dying. So I called Jaji and told her we have to go to the emergency department in the nearby hospital, because I can't tolerate the pain. So we went there, and then I found out that I'm COVID positive. Then I got fever at the same time. Then I was given medications and steroids just to ease the pain, which is very helpful on the next day. So now, on the second day, I don't have much
Just
body
fever.
pain, but I still got that on and off fever.
And then cold and flu.
And on my third day, worst coughing and cold na. Then today I got bad headache again. Then
And a fever.
cold and flu. My Jaji is the one that got it worst. We found out she got COVID the day after I had mine.
Saturday.
So I was tested positive on Friday afternoon, while she got tested positive on Saturday morning. So at first she was fine. she got this very bad dry cough. Then all of a sudden she got a very high fever on Saturday afternoon. So you have to call the ambulance because her fever went up to 40.1. But before calling the ambulance, we did call the health direct. So that's somewhat like a medical support or medical nurse giving medical advice through telephone. So we asked advice first, and we were directed to call an ambulance. And by then, uh, Daddy did some blood test and X-ray, and it was seen that she got chest infection, probably because she got history of bronchitis and pneumonia before, which she didn't tell me all about it. I was just thinking it's just asthma when she was still young. So she got that history of pneumonia and bronchitis. So guys, if you got those, immune or long history, make sure that you need to be open and tell your partner, or at least when someone gonna ask you about your medical history, you have to tell them, because this is the case. I didn't know until I received a call from her mom that she got those history. So it's better that we know their history and we have to tell the medical staff about it, so it would be easier for them to track what needs to be checked or whatsoever. So because she got chest infection and very high fever on and off, she was advised to get admitted. So where she was given with antibiotic, and what else were given?
Antibiotics, and that's it.
Yeah,
Intravenous Panadol.
intravenous Panadol. So Sunday afternoon,
Discharged.
she was discharged. So I need to pick her up. So we need to wear masks because we're both COVID positive. So even though we're in outdoor, we try to really wear mask. Even we're inside, we still try to wear masks when we go to our shared spaces here in the house, since we're sharing the same spaces with our housemate. Just though all the three of us got COVID already, but just to just not to
Prevent.
just to prevent the virus spreading much more. So we're just trying to be more careful as well, wiping, disinfecting the surfaces that we touched, and as much as possible we try to wear masks as well, do proper hand hygiene, and advisable to change your mask from time to time. So yeah, it was a roller coaster journey, and up until now we still feel so ill and no good. So hopefully we'll recover soon. So we got 7 days isolation. I still got my isolation until Friday. And Daddy, when is your isolation gonna end? Saturday. So mine is Friday, and while Judge is on this coming Saturday. So as much as possible, when returning to work, we should not have any symptoms and should be rat negative, especially that we're working in high risk settings. So we can't go back to work because that would, giving exposure to those more vulnerable people or patients that we're working with. So yeah, that's the update, and okay, see ya.